Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist, and here are some of my resolutions for eye health this year. I hope you'll do some of these with me. Let's get started. The average U.S. adult spends over 7 hours on their screens. No wonder everyone comes in complaining of eye strain at the end of the day. To minimize eye strain, the American Academy of Ophthalmology recommends following the 20-20-20 rule. This means for every 20 minutes that you're looking at a screen, you should try to look at something 20 feet away for a total of 20 seconds. You don't need to carry around a tape measure. Just look out the window and focus on a distant object like a tree or a building that is far away. Another resolution that I find very hard to keep is healthy eating. But we have firsthand evidence that certain foods or supplements are beneficial when it comes to preventing certain eye diseases, like dry eye, cataracts, and macular degeneration. In past videos, I've mentioned other vitamins like vitamins A, C, E, lutein, and zeaxanthin. But did you know that omega-3 fatty acids are also very important for eye health? Several studies have demonstrated that people who eat diets high in omega-3 fatty acids are 30% less likely to develop certain eye conditions like macular degeneration and cataracts. There is also some evidence that omega-3 fatty acids can also help with certain dry eye syndromes and reduce the risk of suffering from dry eye. Also, it's important to note that not all omega-3 fatty acids are the same. You want to find omega-3 supplements and foods that have high concentrations of EPA and DHA. This is the type of omega-3 found in fatty fish like wild-caught salmon, mackerel, sardines, oysters, anchovies, and cod liver oil. So this year, I'm going to be supplementing with a high-quality omega-3 fatty acid and eat more fatty fish like wild-caught salmon. Another resolution to consider is to eliminate eye rubbing. The biggest reason to avoid eye rubbing is that you risk injuring and scratching your eye, and you can develop a very gnarly corneal infection from that. But did you also know that constant eye rubbing can actually thin and weaken your cornea? This is because eye rubbing is the #1 cause of a condition called keratoconus, which results in a cornea that looks more like a cone rather than a sphere. If this becomes severe, you may need to wear specialty contact lenses or even require a cornea transplant. So this year, let's quit eye rubbing. If you do have some itching or irritation to your eyes, consider using preservative-free artificial tears. If you have allergies, use a over-the-counter antihistamine eye drop. If things are really bad, please consult with your eye care provider. Another important resolution is to stay away from preservatives in eye drops as much as possible. Most over-the-counter and prescription eye drops have preservatives to help the medication last longer in the bottle. These chemicals inhibit growth of bacteria, but can be very toxic to your eyes. Preservatives can decrease the quality of your tear film, result in toxicity if overused, and is a common cause of eye allergies. So if you have a choice, make sure you are choosing preservative-free formulations. The next thing I want you all to avoid is Visine. No Visine. The problem is you can find Visine and other drops to get the red out everywhere. But these eye drops contain a medication called nifazolin, which is a vasoconstrictor and reduces blood flow to your eyes. Blood flow is important to transport nutrients and oxygen to the structures of your eye, and medications that lessen blood flow can make things worse. Another issue with Visine is you can get a lot of rebound redness when the medication wears off, resulting in maybe even worse redness than you started off with. Also, prolonged use of Visine can actually result in permanently enlarged blood vessels and can actually make your eyes look worse in the long run. If you want a solution to eye redness, my advice is to try Lumify, which is another red eye medication you can buy over the counter that constricts your veins as opposed to your arteries. So it provides redness relief without the long-term side effects. Another resolution is to learn more about your family's eye history, especially any family history of glaucoma or macular degeneration. This is important from an eye doctor perspective because every year when you come in for your eye exam, these are two things that we are routinely screening for. Knowing that you have a family history will allow us to pay extra attention if we do see something that might be suspicious. To risk stratify for your eye appointment, it's pretty important that we have this information as providers and for you to know if you have any first-degree relatives with either of these conditions. Another resolution for this year is to make sure you're getting your routine eye exams. Even if you don't need glasses, even if you don't have any known eye conditions, it's really important that you're getting your routine eye exams. If you are 50 or older, it is recommended that you get an eye exam every year with dilation or at least a retinal screen. If you are under the age of 50 and you don't need glasses and you don't have any eye issues, you should still be getting an eye exam at least every 2 years with either dilation or a retinal picture to screen for any retinal diseases. If you are not sure if you should be seeing an eye doctor more frequently, make sure you ask your eye care provider. This next resolution is my PSA to the YouTube world. If you wear contact lenses, make sure you have good contact lens hygiene. This means don't sleep in your contacts, don't overwear your contacts, don't swim in your contacts, don't rub your eyes when you're wearing your contacts. Generally, when you can, take off your contacts, let your eyes breathe, give your eyes a chance to recover. The reason why it's very important to have good contact lens hygiene habits is it only takes one mistake. One time where you wear your contact lens in the pool, one time where you sleep in your contact lenses to put you at risk of a vision-threatening ulcer. And as a cornea specialist, I can't tell you how many corneal ulcers that I see. Sometimes we can treat it and recover some vision, but a lot of times these ulcers can result in permanent loss of vision and may even require a cornea transplant and lifelong follow-up with a cornea specialist. You do not want that to happen to you. Make sure you are wearing protective eyewear. I just finished a week of trauma call and have seen so many eye injuries from nails, metallic foreign bodies, injuries from sports, fireworks, wine corks. It's always a good idea to be overcautious. And when you are buying protective eyewear, make sure you are buying eyewear that kind of wrap around so that little particles can't get through the sides. This last resolution is one that I'm really bad at keeping and one that I will be working on this year, and that is to wear sunglasses whenever you're outside. UV rays are very harmful to your eyes. Excessive UV exposure can result in a growth on your eye called a pterygium, which is due to sun damage to the white part of the eye. Excessive UV exposure is also a main cause of early cataracts, which are cloudy lenses inside the eye. In addition, by not wearing sunblock or wearing sunglasses, you do increase your risk of skin cancers around the eye. So one thing that I'll be working on is making sure I have easy access to sunglasses with UVA and UVB protection so that I can minimize my risk of these things. You should consider doing that as well. That's all I have for you today. Stay tuned for upcoming videos about cataract and refractive surgery. Thanks for watching, and I'll see you in my next video.